Hello, I'm Dr. Nabeel Arshad, one of the GPs here at the Brook Surgery. A question we're often asked by men is, should I get my prostate checked? In this short video, I want to explain what that means, who might want to consider a test, and what's worth knowing before deciding. When people talk about checking the prostate, they're usually referring to a PSA blood test. PSA stands for prostate-specific antigen. It's a protein made by the prostate, and it can be measured with a simple blood test. So, if you feel well, do you need a PSA test? There isn't a routine screening program for prostate cancer in the UK. That means PSA testing isn't automatically offered. However, men aged 50 and over can request a test if they wish. The key thing to understand is that PSA testing is a personal choice. It's important to know both the possible benefits and the limitations before going ahead. One possible benefit is that a PSA test may detect changes in the prostate early, sometimes before symptoms develop. But there are important limitations too. A raised PSA does not automatically mean cancer. Levels can be raised for many other reasons, including an enlarged prostate, inflammation, infection, or even recent exercise or sexual activity. The test also isn't perfect. Some men with a raised PSA don't have cancer, and some men with prostate cancer can have a normal PSA. A raised PSA can lead to further tests or biopsies, which can cause anxiety and sometimes side effects. This is why we encourage men to make an informed decision rather than having the test automatically. You may want to think more carefully about PSA testing if you're aged 50 or over, have a family history of prostate cancer, or are of black ethnicity, where the risk is higher. If you do have symptoms, please contact us. These include needing to pass urine more often, especially at night, difficulty starting or stopping urine, a weak urine flow, blood in urine or semen, new problems with erections, persistent bone or back pain, or unexplained weight loss. So, what to do next? If you're symptom-free and considering PSA testing, the next step is a conversation, not just a blood test. At the Brook Surgery, appointments are requested using our online e-consult form. You can ask to discuss PSA testing, and one of our clinicians will guide you through your options. There's no right or wrong answer, just the right decision for you. If you're unsure, we're here to help. Thank you for watching.